Okay, perfect. So I'll just start off with your right wrist. And just relax the wrist a little bit more. Perfect. Yeah, so your heart rate is quite slow. Blood pressure is good, but heart rate is a little slow. So do you do regular exercise?
Pretty regular.
Yeah, so it can be from other causes, but it's often from someone who is relatively fit. And then it can be slightly thicker mucus in the sinuses, which is probably eggs and sugar. Do you have much of those?
Yeah, more eggs.
Eggs, and it could be things like bananas or dried fruit. It can be other things like peanut butter and cheese, but I think this is more eggs, sugar, fruit. And that just means that the not just the nasal cavities, but the canals in the skull, when there's better fluid dynamics through there, then you get slightly improved cognitive function, memory, concentration. Yeah, and then there is mild jaw tension, clenching of the teeth, and chest and abdominal tension when there's mild frustration around. I think you drink coffee, no?
More green tea.
Green tea. Do you drink a few green teas?
Yes.
A day, yeah.
Yes.
Okay, yeah. So then the caffeine builds up, and it's similar to coffee. So it just causes a slightly elevated nervous system.
Kickstarts the day, though.
It does kickstart the day, yeah. And it's not a health problem. It's just good to know that it can, when you're having more, several teas a day, that it can cause mild frustration. And do you feel a slight pulse beat around the head?
Not at the moment.
Have you noticed that before? No, not really. No.
On occasion.
On occasion, okay.
Depends what's going on.
Yeah, and a lot of the time that's good. So it doesn't feel like you get any headaches, maybe occasionally on one side, but it's increased blood flow around the head. So saying that the sinus is slightly more congested, but these blood vessels around the brain are more open. The sinuses has a slight problem has a slight effect on the prefrontal cortex in the brain, but then up around the sides of the head, there's much better blood flow.
I find if I'm poking around, then you find a bit that's a bit tender or sore. Yeah. You go, ow, what's going on here?
Yeah. Oh, and a little bit of mucus down the back of the throat sometimes as well.
Yes.
Yeah. And then the stomach acid vapors just a little bit of the vapors can be coming up the esophagus at times, which makes the throat a little bit scratchy, and is also when I can feel that sensation near the ears of the pulse beating. It's partly because of those stomach acid vapors, but it's very mild, and it does dry the mucus in the sinuses a little bit, but otherwise it's fine. And I think a very patient person, and sometimes even you can hold this tension, which the green tea enhances that state of tension mildly, and you prefer to find out what's happening before having your input.
Yes.
Yeah. So one of the later people to speak. And a little bit apprehensive in that. I was almost anxious, but I'd say it's more sort of apprehensive about, I think the timing of you taking action. I'm waiting for the right time. Then the digestion is generally good. Again, there's slight sluggishness, which will relate to, oh yeah, do you have cheese or peanut butter?
Yes.
Yeah, so there's a bit of that going on as well, making the digestive system a little bit slower. But the thyroid function in the throat that regulates metabolism actually is working really well. So it's just when you have more cheese or peanut butter.
This is the season for it.
Yeah, and then it can temporarily slow down the digestion a little bit, but it's not a big deal. And then the microbiome is generally nice and healthy and diverse. You know about the microbiome?
Yes.
Yeah. Okay. So it's apart from this slight sluggish movement of these thicker substances of cheese and peanut butter, there's good movement through the digestive tract, through the stomach, the small intestine, the large intestine. And it feels like you just got, do you work for yourself?
Yes.
So it feels like there's just minor frustrations at the moment and delays and waiting on things to fall into place.
Yes.
Okay, yeah. But there's a trust there,
yes.
that it'll just be patient and it will work itself out. And that's, I think, really a big difference between green tea and coffee. Coffee will make the large intestine a lot tenser, and then it's more difficult to feel relaxed. You just feel more uptight. But actually, the green tea allows you to feel more well-paced and patient. Oh, and then the upper back, shoulders and neck can all get a little bit stiff. You can feel some pressure in the head. Yeah? Would you say you get headaches, or is it not quite headaches, but it's
generally not, but sometimes probably more tension.
Yeah, so it's not only the sinus congestion, but also the neck and shoulder tension, and the upper back feels a little bit stiff. But I think that's just sitting a lot. Are you at a desk during the day generally?
Sometimes.
Okay.
It's one of those things where once you become aware of it, then you do something about it to release it.
Yeah. I'll send you some exercises for those anyway. Okay, let me come around to the other side. And so, yeah, the heart is a little weak. It's a nice regular rhythm, but it's relatively slow. And the blood is slightly viscous. It's slightly thicker than ideal. Again, I think that may be sugar, cheese, peanut butter, stuff like that. Did you have ice cream?
Not at the moment.
Okay, good. Yeah, it's not really the season for it. But yeah, moderate amount of exercise, and so that's keeping the heart well conditioned enough, and the cardiovascular system well conditioned enough, which also is regulating the hormone balance, so it's regulating mood well for you as well. But I think it's gentle exercise generally you do.
Generally, it's doing running.
Okay.
Yeah, running, cycling, walking.
Oh, okay, so it's a good amount of cardio.
Yeah, so it's a mix there.
But do you push it? Do you build up a sweat?
Yeah, if I'm doing like a fast 5K, then you push it. But
okay.
Generally, most of the time it is just building up the cardiovascular system.
Yeah, because it does feel like the heart is engaged, but it could be a little bit more excited more often. That would allow the muscle of the heart to grow slightly stronger, move blood through the heart muscle a little bit more efficiently, and that would give a sense of strength and bite to the heart, a little bit more vigor. But yeah, the coronary arteries, the arteries feeding the heart, feel nice and clear and clean because the blood is very low level of inflammation. The heart muscle itself and the valves and the chambers within the heart all feel nice and clean, and like the beat is without restriction. Yeah, so things like criticism, self-criticism and anxiety will be particular tensions. Dampness will be, depression will be another sensation that depresses the heart, but actually you don't have any of those, really, it feels like. Yeah, and then the diaphragm is a little bit tense, but by and large you do breathe smoothly and deeply. That helps to regulate the nervous system and keep you largely out of fight or flight mode. There's just this mild chronic tension relating to work and nervous patients. Yeah, and the value of the increased cardio or increased exercise anyway, but more vigorous exercise of building up a sweat more regularly. The liver also is a little bit sluggish, There's no real visceral fat around the liver, but it is a little bit, it's underperforming a little bit, and that increased cardio will force more blood through the liver. The liver also, the liver and the kidneys cleaning the blood, that will invigorate the liver and help with fresh blood production as well. But yeah, the liver is clear. Do you drink any alcohol?
No.
No, so yeah, it feels, there's one real benefit of not drinking alcohol is the condition of the liver, actually. So it's got a lack of strain through lack of regular alcohol intake. And then the lower spine can get a little bit stiff as well. Okay. But the spine just feels stiff. The alignment feels good. Feels like the discs are all in place. The knees, or at least one of the knees, can get a little bit crunchy. And they're a little bit inflamed now from walking, running, cycling, something like that. But that will go down. But there's also a little bit of wear and tear underneath that as well. Do you have a problem knee?
More on the left knee, yes.
Okay. And then also, do you get cold hands and feet at all?
I do, yeah.
Yeah, so I think the heart being slightly weaker, but also, were you running yesterday?
Yes.
Yeah, so I think just the blood flow down into the legs is a little deficient because of the running. Do you get cramp at night?
No.
Okay,
No.
good. And then let's just check the prostate, but I'm sure it'll be fine on you. Yeah, great. Prostate all feels fine. That's it. Cool. Yeah, I will send you a list of some recommendations of what you can do yourself.
That's good. It's reassuring to hear.
Yeah,
and sounds like just increase a little bit on some of the intensity and.
Yeah, health is good. Diet is good for the most part. There's just some small little tweaks. You know, like having a bit less sugar, a bit less cheese and peanut butter.
I find with the body's circadian rhythm throughout the day, then the temperature of the hands and the feet, then usually by the afternoon, they do tend to get colder these days, and I don't know whether it's with the age as well.
Can be age. How about protein intake?
Protein intake, reasonable amount. So
it's unlikely to be that. And you could always get a blood test for iron or magnesium levels, but I don't think you've got a problem with any of those. I think just invigorating the heart a bit more. Yeah. Did you do more exercise previously? You used to do?
As a younger man then, yes. Yeah.
So it feels like the heart is underutilized compared to where it has been, basically.
Yes.
So then it's, it grew bigger and it's beating, but it doesn't need as much effort because of it's larger to push the blood around the body. But now that there's not so much activity, it's still beating slower, but not just not pushing the blood as vigorously as before.
Ramp it up a little bit more.
Yeah, just a bit, yeah.
Fabulous. Thank you, George.